I want to say my first inspiration was our pediatric endocrinologist, who was our professor in the medical school. He was a very passionate endocrinologist. He would explain things very simply to his patients, to even to us. So whenever I have my first visit with a patient, I really enjoy just starting to see what are the things that are concerning and what the things that my patient wants to address. And I'd like to educate the patient about the disease that we're treating and how can they be part of choosing their own management plan. Also, I like a lot just explaining what options the patient have that in their toolbox and how can they be part of the decision making. I think these are the main things. I'm very passionate about diabetes and diabetes technology and about bone disease, especially osteoporosis. Metabolic bone diseases are my main areas of interest. I do like to create a long-term relationship with my patients. I do like the idea of having to explain to patients their pathophysiology of their chronic disease, how they can manage it, how can they be part of their disease process. I do like seeing the improvement in their disease process long term. So this was one of the main things that I wanted to pick endocrinology, is the long-term relationship with patients, see how they grow, how they improve, and how they learn management of their disease. The thing that's most satisfying to me is when I explain to patients about their pathophysiology, help them understand more their disease pathology and physiology. I love going back to even basic science just to let them know what's the negative and the positive feedback loops in endocrine means, what the test results and like their own interpretation of their test result means. So this is like the most satisfying thing to me. And of course, seeing them taking more action in their disease process, managing and understanding more about their disease is one of the most satisfying things to me. That's like my biggest satisfaction in the field. But definitely I do like education a lot, especially to my patients, and let them understand what I'm doing, how to interpret their tests results, how to take action, how to be part of the decision making is just the most satisfying thing. Hi, I'm Randa Sharag Eldin and I'm an endocrinologist. I practice at Frederick South.